And we'll now go to Mr. Johns for 6 minutes.
Thank you very much for being here. Thank you for the important work that you're doing. Can you speak about COVID and how it's impacted both on the work that you're doing and, of course, the government in terms of budgeting? I can't imagine the challenges you're facing. Maybe you could speak to some of those challenges.
Well, the challenges that it has represented for the office and still continue to represent is the workload has increased because of the government expenditures. And there was, at the early outset of the pandemic, there were not a lot of information being made available to Canadians on the budgetary situation. So we had to step up and provide that information. And it's also meant a lot of work for the employees, the staff in the office, to try to independently estimate the cost of the multiple measures that were put in place. So that was one impact. And as millions of Canadians, our employees had to work from home for a significant period over the last 2 years, and some continue to work from home for at least part-time. So it has presented challenges, but in that sense, we're no different than others. And what it's meant for the fiscal situation, as we have seen, it's meant a dramatic increase in government expenditures and the deficit, for which the government is still recovering by lowering the expenditures, the extraordinary expenditures under COVID, and slowly returning to a more normal level of deficit that is closer to what we saw before the pandemic.
In your reports on the main estimates, 2022-23, noted that the Canada Health Transfer, which is obviously the largest transfer between the provinces and territories, is set to increase by 2.1 billion, 4.8% to 45.2 billion in this fiscal. You projected that by 2026-27, transfer will reach about $56.1 billion to cover the rising healthcare costs. Provincial, territorial premiers have asked, as you know, the federal government to increase the share of healthcare costs by the health transfer. Should the formula used to calculate the health transfer be revised?
That's an excellent question. I don't think I'm the best person to answer that question, given it's a matter of policy and it's up to the government to decide how fast or not it wants to increase the Canada Health Transfer.
Okay, so given that, have you analyzed what it would cost to increase that significantly, Canada's share, in terms of working towards the former arrangement back when Tommy Douglas worked on bringing healthcare to 50-50 was the agreement initially. In terms of each percent towards 50-50, have you costed out what that looks like?
I don't remember having costed that. Certainly not, well, I shouldn't say certainly, not since I was appointed. Maybe we did and I forget, but if that's the case, my apologies, but I don't think so.
We've got over 235,000 homeless people in Canada. Have you costed out the cost of what it costs overall for the healthcare system, criminal justice system, because we know many people end up in the criminal justice system, mental health care, all of that? Have you costed out what it costs the overall society?
Again, I'm probably a disappointing answer, but we haven't costed that. It would be a tremendous undertaking because the costs are multiple, as you pointed out. So it would be challenging, but we have not costed that.
Being that it's such an enormous cost, do you think it should be costed out and the government should provide resources so that you can? Because if we're going to get to the root of these problems and save taxpayers money in the end by providing solutions,
Again, that's a very good question.
Do you have the resources to conduct such a study, do you think?
If I was to undertake the costing of such an important and complex issue, I would certainly have to drop other aspects of my mandate.
So without dropping aspects of your mandate, would additional resources, if they were provided to do that, you could do that job, but needing that additional resources so it doesn't impact your mandate?
We could certainly look at ways of doing that, and given that it's a multidimensional issue, I'm not sure that we would have an estimate that would be robust, but we could probably come up with a reasonable approximation of the multiple costs.
Just away from housing, obviously, there's a toxic drug supply issue. 27,000 Canadians have died in the last 6 years. have you done any costing around the criminalization of, right now there was a report done by experts on the substance use task force. They quoted that it was $6.4 billion just in policing alone in 2017. So here we are 5 years out. Has the PBO looked at what the cost of criminalizing people who use substances, given that this task force, this expert task force by Health Canada says that criminalizing people who use substances is causing more harm than it is good?
So we have done costings of repealing some mandatory minimum penalties on some types of offenses, but we have not looked at the cost of criminalizing some drug offenses.
Is it something that your office is considering?
Not at the moment, but if there's a desire from the committee to have our office look at that, it's something that we could certainly at least consider and try to determine if it's feasible for us to do that, and if so, to undertake that kind of work.
Thank you, Mr. Johns.